Those are my two.
Yeah, well, to answer your second question first, we've been working this issue with in the Senate primarily, because that's the narrow margin, and we have a one vote majority in the United States Senate, and we have been working with a lot of offices, and we're optimistic that we can get to the 50 votes. We don't think we can get 51 senators. We think we can get 50 senators for this bill, and get the vice president to break the tie, which he can under the Senate rules. So we think we can get there. We're not there. Don't get me wrong. We're not there yet. Most senators don't even know this bill exists. But from our briefings with staff and from our conversations with senators in the past, we think we are designing a bill that we believe can actually get through the United States Senate. So that's number one. Number two, how does it help people? And this is a really great question. How does Obamacare affect? I mean, we're spending over $1 trillion over the next 10 years to really address roughly 10% of the people who are in the insurance market. As you mentioned, most people have private insurance through companies, through big companies, or through the government, Medicare or Medicaid. And so what we've done here is we have taken these huge amount of resources being spent mostly to increase Medicaid. And Medicaid is an incredibly inefficient, very profitable. This is the thing people don't realize. People are talking about the Obamacare exchanges and how much money is being charged in these policies on the private sector exchanges. That's because the insurance rules that Obamacare passed make it impossible for a vibrant marketplace to thrive. So most everybody who is participating in Obamacare, if you will, is in Medicaid. And Medicaid is an incredibly profitable arm of business for insurance companies. Insurance companies are making money hand over fist because Medicaid pays the least amount. This is how it affects you. All these people going into Medicaid is the worst payer from private sector to Medicare to government insurance. Medicaid's the worst payer. We're going to get people out of Medicaid. Yes. So now you understand how we can help is by eliminating Medicaid expansion, putting that money out into the private sector to have private payers paying into the healthcare system is going to do a lot to lower premiums for everybody else, not just lower premiums for. So insurance companies are now going to have to be competitive as opposed to soaking up huge amounts of government resources by running a very, very profitable Medicaid expansion. So that's how it helps you.